Hello, my name is Shelda Summons,
My name is Sylvie Akum.
and today we'll be performing for you a full cardiovascular assessment. The first part of the assessment is going to focus on the peripheral vascular system.
And the second part of the assessment will be the assessment of the heart.
We hope you enjoy the video.
May I please come in?
Yes, come in.
My name is Sylvie. I'm going to be your student nurse today.
Okay.
So how are you doing today?
I'm okay.
May I please have your name and date of birth, please?
Name is Navy Carr Valentin, March 8, 1996.
May I please verify real quick?
Sure.
So today we'll be doing a cardiovascular assessment. Are you okay with that?
Yeah.
So I'll first of all start by taking your vitals, then we can go from there.
Okay.
Do you know where you are?
Yes, I do.
Do you know why you are here?
I'm here to get a heart assessment.
Perfect. Can you please tell me the date of today?
Today is April 4th, 2018.
Great. So my patient is well oriented and alert. So I'll go for that to take your temperature.
Okay.
Can you open your mouth for me, please?
Sure.
So her temperature is 99.1. So I'll take the oxygen saturation while I'm doing your pulse.
Okay.
So her pulse is 60 breaths per minute. Her oxygen saturation is 99 and her respiration is 14 breaths per minute. So now I'll take your blood pressure.
Okay.
Can I please have your hand, please?
Sure.
So I'll stop at 160. So her blood pressure is 110 over 70, which is normal. So when you're doing the blood pressure, the normal range is 120 over 80. Anything above 140 over 99 is considered hypertensive. When you're doing a skin assessment, you check for general appearance, the skin color, the breathing patterns. The normal signs will be skin matches raised, the patient well oriented, has a steady and unlabeled breathing. The abnormal will be pallor, blue skin color or sinuses, use of accessory muzzle breathing, and patient present in tripod position. Before I start with the peripheral assessment, may I please ask you some few questions?
Sure.
Have you noticed any cramping or pain in your leg?
No.
Have you noticed any skin discoloration lately?
No.
But have you noticed any swelling in your upper and lower extremities?
Nope.
Okay, I will feel for your pulse. May I please have your hands, please?
Sure.
So I'll check for your radial pulse. Then I'll check the ulnar pulse. I will check for your brachial pulse. Excuse me. I'll check for your temporal pulse, your carotid pulse. Can you please lay down for me so that I can inspect your jugular vein?
Sure.
Can you look to the side? Can you look towards me, please? I will check for your posterior tibia pulse. Then I'll check for your dorsalis pedis pulse. I'll go further to check for throbbing. I'll do capillary refill. I'll check for feeding edema. Then I'll use the back of my hand to feel your temperature. Can you flip to the other side so that I can feel your popliteal pulse, please? And I have to pull your pants a little bit up. So I'll feel your popliteal pulse. Can you stay back on the bed? When you're taking the pulse, the normal pulse rate is between 60 to 100 beats per minute. Abnormal will be less than 60 and greater than 100. When you are inspecting the nape bed, the normal finding will be 160 degrees at angle. Abnormal will be 180. So when you are inspecting the jugular vein, it should be palpable. Abnormal sign will be distended jugular vein. If the rhythm is irregular, it indicates right side heart failure. We have finished with the peripheral vascular assessment, so my colleague will be coming to do the heart assessment.
Okay.
So when looking at the anterior chest wall, you look for contour, pulsations, lifts, heaves, and retractions. For contour, a normal finding would be that the chest is rounded. Abnormal would be if it's asymmetrical or sunken in any way. Pulsations, a normal finding is that you don't usually see any of those. Abnormal would be that there's throbbing pulsations, and that usually indicates that there's an increase in the blood volume or blood pressure. Lifts and heaves, a normal finding is that it's not usually present. You don't see movement like that in the chest wall. Abnormal would be that there's vigorous movement of the sternum and the ribs, and that's caused by forceful cardiac contractions. Retractions in the anterior chest wall are usually very slight. and that's found at the left mid-clavicular line, which is where you find the apical space. That would be a normal finding. Abnormal would be if there's a marked retraction of the apical space. It's like, really deviated, and that usually indicates that there's pericardial disease or that there's right ventricular hypertrophy. Okay, so we're about to begin the assessment of the heart. First, I'll just perform hand hygiene. And before we get started on the actual assessment, I'm just going to ask you a few questions. Do you experience any chest pains by any chance?
No.
Do you have a history of heart disease in your family?
No.
Do you experience shortness of breath when performing activities?
No.
Okay, that's great. Well, I'm going to go right ahead and we're going to start the heart assessment. I'm going to go ahead and I'm going to listen to your heart sounds. Is that okay with you?
Sure.
It means that I'm going to be touching you, so that's fine?
Okay.
Awesome. So we're going to go right ahead, and the first thing I'm going to listen for is the sounds of the aorta, and we can find that in the second intercostal space on the right side of the chest. And I'm going to go right ahead and I'm going to listen there. Okay, that sounds good. And we're going to go to listen to your pulmonic sounds, and that's in the second intercostal space of the left side of the chest. That sounds fine. We're going to go down to the third intercostal space to Erb's point, and we're going to listen there as well. We're going to go down to the fourth intercostal space. We're going to listen to the tricuspid. And in the fifth intercostal space is where we're going to find the mitral. Awesome. And in that space is also where we'll find the apical pulse. And I'm going to palpate that and just take your pulse for a minute. Awesome. When palpating for the apical pulse, which is also known as the point of maximal impulse, or PMI, normal would be that the PMI is found in the fifth intercostal space left of the midclavicular line. An abnormal finding would be that there is a lateral movement or shift of the PMI, and that would be due to an enlarged myocardium. Or another reason why that would happen is if there's a chronic obstructive lung disease, which causes the PMI to be displaced downward and a little to the right. When auscultating for S1 and S2 heart sounds, we look for the rate, the rhythm, pitch, and for splitting. A normal finding in the rate would be that it's between 60 to 100 beats per minute. Abnormal would be that it's below 60 beats per minute or it's above 100 beats per minute. When looking at the rhythm, we're listening for regular and equally spaced beats. Abnormal would be that the beats are coupled together or that it's unequal. Another abnormal finding would be that the beating is irregularly patterned or there is even irregularity. When looking at pitch, a normal finding would be that the S1 sound is lower pitched and the S2 sound is higher pitched. Also, a normal finding would be that S3 heart sound is found in children and in pregnant women. An abnormal finding would be that there's an S3 sound, and that's in adults over 40 years old. That usually indicates that there's myocardial failure. And if there's an S4 sound, it's caused by coronary artery disease, myocardiopathy, hypertension, and aortic stenosis. When listening for splitting, a normal finding would be that there's one sound which indicates that the valves are closing together. They're synchronized. An abnormal finding would be that there are two separate sounds which indicates that the valves are not closing together. When listening for the heart sounds, S1 and S2 sounds should be heard clearly in every area that's auscultated in the intercostal spaces. When calculating the pulse deficit, you need to palpate the radial and the apical pulses simultaneously. A normal finding would be that the beats per minute of both pulses are equal. An abnormal finding would be that the apical pulse, the beats per minute, is higher than that of the radial pulse, and that usually indicates that there's a cardiac dysrhythmia. And the most common of those dysrhythmias is atrial fibrillation. Okay, so now we've completed the assessment of your heart and the peripheral vascular system. At this time, I'm just going to ensure that you're made comfortable. I'm going to lower your bed back to the lowest setting. I'll place the call bell close by. If you need anything, just go right ahead and press that, and I'll be right in to assist you. I'll place all of your belongings close by so that they're near to your hand reach. I'm going to assess the room for safety, make sure that there's nothing out of place. Before I leave, I am going to document that the procedure was done today, what our findings were, what your response was, or your reaction to those findings. I'm going to document that I'm the one that did the assessment, and I'm going to perform hand hygiene at this point and exit your room. Is there anything else that I can do for you today?
No.
All right then, have a good one.
Thank you.